Can I get a drink if I'm...
Yes, of course. Yes. Bring that over here, of course.
There you go.
Okay, girls and guys, we're live.
We're live?
Mm-hmm.
Hi, everyone. My name is Grace. This is Dr. Jeff Kerber. We'll call him Jeff for our purposes today. We're here talking about suicide prevention, things like that. As a specialist in family counseling and as a therapist in that area, I think maybe we should start by defining what suicide prevention is and what you do in that area. Maybe start there.
Yeah, perfect. Okay, and perfect. That's a wonderful general way to approach the topic. First and foremost, anybody who's a professional in mental health and or in substance abuse work, or frankly, even in our primary care offices around the area, I think everybody really needs to be dialed in to kids, adults who are going through mental health issues, transitions in their life, may or may not have had a mental health history, or anytime there's a noticeable change in their kind of baseline mood and appearance and other symptoms that might come along with that. And we need to just really ask the question. We need to be thinking about the question. I think there's a lot of people who are professionals in those different disciplines who are attending to our patients and our family members and people in our community from a medical perspective, which of course is what we do. It's clearly important. But along with that needs to come a real reconnection of our mind and body. And so much of our medical attention and expertise is devoted to understanding disease and health and wellness. And a huge significant portion of that has to do with whether or not people are also mentally healthy and if their relationships are healthy and if they're if they're exercising good habits in their lifestyle in regard to use of substances and a whole host of things, not the least of which is nutrition. I mean, it runs up and down the gamut of our existence. And so first and foremost, prevention, I think, just comes in the form of just paying attention as healthcare professionals, mental health care professionals, what's going on with the people that we have the privilege of interacting with.
And how you mentioned paying attention to those things. So I hate to use the term risk factors, but when you look at a person that could potentially, you think that they could be more than just depressed or seasonally depressed, what are the things that you should look for and think you should reach out to a person if they are in a time of need?
Yeah, no, that's perfect. Yeah, there's a whole there's a whole body of literature that is easily found through simple Google searches or online searches for information. But I think if you were to do that, you would routinely come up with a very similar looking list of risk factors. One of the most important things to keep in mind, and it's relatively easy to determine, well, frankly, the most easy and most important piece of the puzzle to determine is just to ask people a question. If you have any instinctive concern about whoever you're sitting and visiting with, there's a whole body of literature about gatekeeping for prevention of suicide. And there are a number of different programs that are developed and have some good evidence support for being helpful in prevention for people to just simply be aware and ask the question. So one of the most important things to even start thinking about risk factors is to pay attention to your own instinctive concern about the people that you're with, and whether that's family members or friends or in professional work, patients and such, to just be aware and then to ask the question. And maybe it starts off with the basic statement of concern. I'm concerned about some of what I hear you say and some of what I think I see in the way that you and I are talking. I'm worried that you might even be thinking about things like hurting yourself. And then as you hope to have an authentic or genuine response to that question, you can start to learn more and start to ask more about other risk factors. For example, when we think about a lot of people who have attempted suicide, we know that often, not always, but often a mental health disorder is a part of the equation for those people. So if you know that someone has been diagnosed or receiving treatment for depression or anxiety or a host of other mental health problems, clearly that is a significant risk factor. So that's a check. But it's not true that everybody who's depressed is also suicidal. It is often true that people who are suicidal are often depressed. So we can start asking things about their symptomatic presentation. Are you sleeping okay? Are you what's going on with your diet? What's going on with your ability to focus or concentrate, either when you're at school or in your work environment? How are your relationships? We know that a lot of times for men, a risk factor tends to be irritability. And for women, a risk factor tends to be, these are not always true, but in stereotypical ways of thinking, a risk factor tends to be more quiet, emotionality, sometimes isolation. Isolation looks different for people in a lot of different ways, but in general, that's one of those risk factors. Do people feel isolated? Do they feel engaged and connected to other people? And so we can ask those questions. Who are you talking with? We can ask questions about what their plans are for the future. Do they have what we think of as a future orientation? We can ask them about whether or not they have hope. And so the classic thoughts about hopelessness and helplessness are still very relevant questions that we can put into conversation with people if we start to worry that they may have some thoughts about suicide to begin with. Other risk factors that are really important: access to lethal means. We know that about a good half, if not more, of completed suicides, and this cuts across adults as well as kids, are happening because they have access to a lethal mean like a firearm. And so an easy risk factor to ask about is whether people have access to firearms. When I'm out doing presentations in the community and I have a chance to visit with parents and I ask this one question, it's almost inevitable that I see a lot of people kind of get uncomfortable in their chair.
Yeah.
When I'll ask them, in your neighborhood, do you let your kids run around and play with the other kids in the neighborhood? And maybe playing around isn't right for 16-year-olds, but do they hang out with kids in their neighborhood? Or of the neighborhood or the houses that you know your kids are friends with other kids, do you have any idea whether or not in those homes there are firearms? You know your own home.
Of course.
But do you have any idea? And I've yet to hear somebody say, yeah, with confidence.
Yes.
Yeah, and if there are firearms, do you have any idea whether or not they're appropriately secured? So access to firearms, presence of a mental health disorder, and then the severity of that disorder at that point in time. Are symptoms really overwhelming at that time? Are they receiving any care, mental health care, specifically if they have a mental health disorder? There's others, but I'll take a breath.
Well, I was going to say, I know that, as you said, stereotypically, which, often stereotypes have been formed because patterns evolve within people. So I feel like that's a justified explanation for situations like this. However, are there times where traumatic events could spur suicidal thoughts in a person? What are some of those events that maybe people should be aware of in their loved ones?
Yeah, great. So you very rightly have turned attention to a precipitating event. And so, unfortunately, that can be very difficult to discern because of the way that people have such a unique perception about what a precipitating event may be. But that being said, it's not impossible to sort this out. If someone's in the midst of a divorce, or a loss of a family member, or even the perceived loss of a significant survival quality relationship, don't mean to be morbid in a conversation like this, even though in some ways it might be appropriate. If someone close to you were to pass away today, even from a natural kind of cause, that would profoundly affect your thoughtfulness about the day, your ability to function in the day, et cetera, and so forth. If someone who you don't know out in our parking lot right now were to pass away today, you would barely notice it. It wouldn't affect you whatsoever. And so there's this real different quality about those survival quality relationships that have an impact on people's lives. Unfortunately, it's really difficult for all of us to know exactly who those people are, particularly with kids. So with kids and adolescents, their decompensation, they rapidly lose perspective based on their perception of their emotional and relational environment. Further complicating that has to do with their life through social media. And so the way that they perceive others who are either holding positive opinions or negative opinions of them through what they see in social media can lead, unfortunately, to a real rapid decompensation of self, of resilience, and if accompanied by other risk factors, perhaps substance use, perhaps instability in their home environment, or those traumatic variables, or trauma-informed care tells us about those adverse childhood experiences in their own history. And if all of those factors are just behind the curtain, so to speak, and then there's a precipitating event, it could be as simple as a failing grade, or it could be something like a rebuff on social media or in person in a relationship.
Yep.
It could just even be worried about whether or not they have a bright future ahead of them. So many people who are younger, who are in the millennial or younger age group, are concerned about the general status of our world. Will there be economic opportunity for me? Is there a sense of future that includes work and a home and relationships that mean something to me? And so their vision of the future can be profoundly affected by the stresses that we have day in and day out, or those precipitating events. And depending on what they're bringing to the table from their history, because of potential adverse childhood experiences, that's why it's so important to just be engaged and to pay attention.
Of course, yeah.
Because it can happen quickly, and it's important if we don't notice, if we're not looking for it to begin with. Unfortunately, people can make an attempt, and it can be a completion, and then there's an awful lot of thoughtfulness when it's too late.
Of course. Something I find interesting is that I would say a majority of the time people look at suicide as being how we just discussed with adolescents and teenagers and kind of a younger age. Obviously that's not true. It can happen to anyone at any time based off of all the things we've talked about. And suicide rates have grown rapidly in the past 2 decades or so. With that being said, what are some things that people, if we are engaged, if we are paying attention, if we are having those conversations with people, what are some things that you think people shouldn't say or shouldn't ask?
It's a great question. It's a great question, because that is one of those things that first and foremost I think really scares people about engaging in the conversation.
Of course.
One of the most important myths out there, of course, is the idea that if they ask, they're actually going to in some way further the likelihood that somebody will become suicidal. There's literally no research, and there's nothing in my 20 plus years of experience that would suggest that that is a reasonable concern. Quite the opposite. Almost always when people are genuinely suicidal, they feel isolated and disconnected and fundamentally misunderstood. And so when we ask the question, it's the beginning of us re-engaging, and it's the beginning of us being able to help them feel like someone can understand. And so what I think of, and the way I try to talk about this with various groups whenever I get a chance to talk about this, is what we think of as a stability and a change response. I'll explain that very quickly.
Okay.
What we're looking for is a stability response when someone feels genuinely suicidal. And the way that looks is this. I hear that you're feeling suicidal. I hear that you're feeling like hurting yourself. I really want to know what's happened. How is it that you've gotten to the place where you really think about this and you might actually try it? And then the important piece is to keep your mouth shut and listen.
Okay.
That's a stability posture. That's me saying, wow, okay, this is going on. I want to try to understand this. So I'm going to be with you. I'm not going to be scared of it. I'm just going to be a human being with another human being. I'm going to try to sort this out with you. A change response, the thing we don't want to do, is you've got so much to live for. You shouldn't feel this way. Your parents are wonderful. You've got such a bright career. You've got a wonderful education. All these things. I mean, you're just this. Tomorrow morning you'll feel better. While that might be well intended, and it may even be true, all those factors might actually exist to an objective outside observer. To that person in that moment, there's a tremendous sense of isolation. It's a loss of perspective fundamentally, and they don't really have any vision for the way that they can be okay in the next moment, in the next hour, in the next day. And so for us to tell them, you're wrong, things are actually going to be okay.
It feels dismissive.
It's more disconnect. It's more disengage. It's more, I don't get it. I'm one more person who doesn't get you.
And then you probably feel further away from where you wanted to be.
So you've actually increased the risk.
Okay. So avoid the change response.
Just understand stability. Just stand there with them. Stability.
Listen.
Don't get them to try to change. Or no, don't feel suicidal. Just change.
Yeah.
Don't do that.
Because I think with the change response, I think that comes from people feeling fundamentally scared.
It's their anxiety.
And it's
right.
their own anxiety and
Right.
their incapacity or feeling as if they are incapable of listening and doing the thing that they need most
Right.
for another person. So
Right.
I think those are really important things for people to keep in mind because
Right.
frankly, suicide is a really touchy subject still for whatever reason.
Yeah.
And I think that because it's not discussed as much as I think that it should be, I think that people are really uneducated how to even go about it, how to, even if they saw the signs, how do I start that conversation? And I think knowing that just listening to someone, as basic as that sounds, I think can make a world of difference from everything that you've said and things that you've seen.
And you point to something that's very important. Recently, of course, legislation's happened in Iowa that necessitates, educators receive some additional annual training on just asking the question. And that's critical. I mean, there are certainly physicians, there are even therapists. I've been doing this work for some time, and it is occasionally, even among mental health professionals, who will be reluctant to ask. And they certainly know better.
Yeah.
But it is emotionally a very stressful event when you're sitting with somebody who is sincerely communicating and authentically in a really dark, isolated, disconnected place. It's really frightening in a lot of ways. And it almost taps into our own, dark moments too.
Yeah.
And if we're having even a bit of a difficult day or a difficult week, it's not too difficult to understand why you might want to try to just walk around that instead of walking right with them. So I certainly am not trying to say, well, we should just do better. It's not that easy. I'm trying
of course not.
But it's critical. And so, for people to rehearse the question, I mean, you think about, stressful things in people's lives. When you're going to ask somebody to marry them, chances are you rehearse that.
Yeah.
If not, just in your mind a little bit, maybe in those moments, in the bathroom mirror when you're brushing your teeth.
Yeah.
I know that might sound a bit unreasonable or a little bit extreme, but I really would suggest, as a matter of public health, that people ask that question just to practice and to think through, to have a language for emotional competency is critical, and it's most critical when people are suicidal. So to be able to say, wow, I just got worried. You just said X, Y, or Z, and I'm worried you're thinking about hurting yourself.
Yeah, it's a big question, but I think, like you said, as public information officers, as a matter of public health, in your words, which I think is a really great way to put it. When other illnesses befall people, you can talk about it, and it's usually sad and tragic and whatever, but mental health is equally as much an illness that even though you can't see it, it still hurts people in the same way that something else could.
Absolutely.
So I think, kind of like you said, it's not like we need to do better. I mean, this is such a hard thing to say that about, but I think understanding that there are small steps as people, not an expert, not anybody, just as a daughter, as a sister, as a classmate, as a teacher. There's so many things that you can do to just pay attention to people that you care about, that you're in contact with every day, that you see and you talk to, and I think that can make a big difference. So.
Yeah, and not only, I know I've talked a good deal about kids and education and such, but you were right earlier to point that there is, of course, a problem with suicide risk across the age continuum for all of us. One of the highest completed categories, one of the highest categories of completed suicide are with older white men. And there's so many social threads that we could probably tie to that reality. That generally speaking, men are not as emotionally competent, or not as encouraged throughout their lifetimes to be as emotionally competent. So gender is a risk factor. So for us to be paying attention to men when they retire, and they lose a sense of their identity, and they are clearly at risk to become more isolated. They're no longer in their work environment with those relationships that they may have had for 30, 40, 50 or more years in some cases. So there's risk across the age continuum. It's often associated with significant life changes, starting families, families dissolving, families changing, deaths of other important people, whether they're family or otherwise. Those risk factors can come, of course, at any point in time for people in their lives. And at different points in time, there's different professional people who are involved with us in our lives. So I think about assisted living homes, and I think about nursing homes, and I think about places that have more routine contact with elderly portions of our communities. Equally as much as it's important to think about the way that kids in high school can be at significant risk, and mothers, immediately upon the completion of, or after birth, postpartum depression is a very unique risk category because of the way that there's so many mixed messages that are coming at those women, and it's something that I know that our UnityPoint OB physicians pay an awful lot of good attention to. So yes, people need to be aware, no matter what strata of the community that we live in, no matter what age you are. It is something that genuinely deserves the kind of attention that buckling your seatbelt deserves.
I'll ask at this time if anybody has questions, they can type them in and comment, and we'll answer them as they come in. Lindsay, do we have any right now?
No,
Not yet?
Currently just keeping up the good work, and that this is great information.
Perfect. Well, if you guys have questions, write them in and we'll try to answer them here.
Okay.
Something that I thought was interesting that you said, though, was about how, well, I guess I should say, yes, we've talked about traumatic events, we've talked about maybe a history of mental illness, things like that, but I also think that often, in hindsight, you look at these people that may have completed a suicide and you think, that shocks me. Like, I never would have thought that that person would have done something like that. And granted, I think that that could change if people kind of heeded your suggestions and think about what we should do. But on the flip side of that, I think that it proves that, like you said, people maybe are not raised to have certain emotional competency that you are in your it's just it varies so much. I guess I think that with things that we see in headlines, and especially in the past couple weeks with high profile suicides, does that usually influence how trends are in our own communities?
Yeah. We were visiting earlier about the way that it's unfortunate, but whenever there is a more high profile or a member of the community who has some particular type of public status, and if they happen to be one of the people who complete suicide, then there is always an increased interest for a while. Youth suicides in school districts, there is generally a heightened awareness and interest in understanding how does this happen. And you're so right that people often will be reflective and often hand-wringing, saying, we never suspected that person.
Exactly.
They had so much going on in their lives that looked positive from the outside. Athletics or music or scholarships heading off to college, or whatever the case may be, or celebrities who apparently have all the money that they need, they have homes, they have status, they have all these things. So it really points to the way that no matter what you can see of someone from the outside, it's really important to be engaged and to try to be at least present and aware of what their very individual experience may be like. And part of that, here I'm going to sound like an old guy. Part of that awareness has to do with maybe putting down phones more often. And I can't tell you, I'm very lucky to have healthy kids, and I coach baseball, and it's fascinating to me sometimes to be coaching baseball and look at parents watching in the stands, and they're not watching their kids. They're checking out what's going on their phones. And some people have work. I understand I'm not a member of the Lead Pencil Society. I understand that that I have a phone too, and I look at it frequently too. But it seems as though there's room for us to perhaps pull back a little bit and to think about, at the end of the day, really what's going to be the most important part of our lives. And if your phone were to get smashed, you get a new one. But if your child dies, you don't get a new one. And so I realize that that's such a heavy thought that you can't walk through every day and think, oh my gosh, we just don't live like that.
Mm-hmm.
You don't get in your car every time you get in the car, you don't think, I could have a head-on collision.
Of course not.
You don't think that. I'm not suggesting that we should think that, but sometimes, the new legislation requiring educators to at least think about it once a year, an hour of training a year, is going to help.
I think so too.
It's going to help. It may just help one or two, but that's worth the effort.
Mm-hmm.
So awareness connected to these events, is always an interesting mixed bag. You have this tremendous sense of loss. That somebody's family, is just devastated. I've sat with those parents. I've sat with people many, many times, and it's a profound change for them. And it's not going to go away.
Yeah.
But at the same time, it's an opportunity for us as a community to think about it and to be engaged with it. What's sad is that no matter how much we think about it, from epidemiological research, we know that 5 to 10%, depending, of completed suicides, there's this virtually no sign that this was coming. And I say that because I want to bridge to another comment. That often the motivation for suicide is very ambivalent, particularly with young people, but also with adults. In other words, often suicides happen because people attempt, but they didn't really want to die. And so it comes back to emotional competency and our ability to talk about just how and be engaged with just how people are feeling and navigating their lives, is the proactive measure, is the proactive attempt to prevent.
Mm-hmm.
When things get further downstream, unfortunately, and if and when they do, then we have to ask the question, do you feel like harming yourself? Do you feel like killing yourself? Then we have to take steps to try to prevent that from happening, and all the emergency kind of stuff, the critical kind of stuff. But if I could have my cake and eat it too, I would back the truck way up.
Yeah.
And I would really try to do and there's a lot of good work happening. First 5, attention to adverse childhood experiences, just attempting to make kids' lives more stable, more calm, less traumatic, in hopes that we know that their brains develop differently, that they're more emotionally resilient, and that they're able to handle the inevitable challenges that are going to come along with life.
And I think something that is so important that you said is prevention. With most things is key, but I think with this especially, you don't get the second chance.
Yeah.
You don't go into remission. It's one or done. And I think prevention is the only thing that we have. And I think that it's applicable to every person. It's not just if you're a parent or if you're a spouse. It's every person. And I think being aware of that is so important. So do we have any questions, Lindsay?
No, I have a quick question.
Okay.
Though. So I just wanted to bring up, after kind of what you shared, and you're a family counselor, so you probably see children a lot. That maybe the prevention part of it and talking about it with children, like what advice would you give to parents who are out there thinking, I wonder if my child has these signs, or my child isolates, or maybe is more antisocial or doesn't want to go out, or when's too early to start talking about this, and are there certain words I'm supposed to use, or should I actually use the word suicide, or that it's final. I think that that's something that in my friend groups or in the community or in, at work, we've heard that, they maybe can't see past the next day.
Right, yeah.
And it happens, and something happened on social media. And I think that's something else you mentioned. And social media is just different than it was 10 years ago. Yeah. So could you speak to that?
Yeah, well, you asked about 4 or 5 really good
Sorry, and I'll back up.
I lost track of some of them, but I'll just kind of jump in.
Yeah, go right ahead.
Yeah, no, first and foremost, helping parents help their kids. So you're always trying to broaden the treatment team, so to speak, right? And so, part of our effort to put information out in whatever way we can, part of our effort when we're actually working or talking with parents in a counseling environment, or part of what I think should happen out in our primary care environment, where a lot of families are touching us as healthcare professionals, or then around work, kind of, touching them in their lives. So the encouragement for parents to be emotionally skilled and to be emotionally competent, I think should be just part of the well child visits. That should be woven in with the way that we approach, kids' health in general. Again, reconnecting mind and body. It's It's not just about whether or not they've had immunizations, and those are clearly important pieces of health, but whether or not, how often, it would be nice to see pediatricians ask questions of parents. How often do you ask your kids how they feel? And how many times are they able to give you a response that actually makes some sense, instead of hungry? That might be true, but that's not necessarily what we're aiming for. So it's not rocket science, but it takes attentiveness, and it takes mindfulness, and it takes presence to ask your kids and to just be, for a moment, really listening, putting phone down and listening how they feel and paying attention. Most often what kids do is they act out feelings because they lack the life experience and the mental capacity to actually articulate feeling. So that is literally the process of emotional education. They're doing things that are irritating to you as an adult or as a parent. And so the right response should be, I'm irritated because of what they're doing. I'm guessing that they're irritated in some way as well. And so instead of engaging in somewhat of a ridiculous power struggle or something along those lines, you might want to ask them, what's going on that's irritating or making you mad, depending on their age and vocabulary and such, right, the right words. You seem mad, you're making me feel mad. I'm wondering, how come? What's going on that you feel mad? That's as complicated as it needs to be, particularly for younger kids. For older kids and teenagers, almost every 14-year-old appears to be isolated and mad a good portion of the time. So all of the physical and emotional changes that are happening for kids at that age range, in those early adolescence, tween, preteen, all those kinds of stages, can make this whole effort to create a language of emotional competency more complicated. So I'm not going to try to oversimplify that, but it's important. It's going to be less complicated when they're teenagers if you've done the good work when they're 4, 5, 6, and so on in elementary school years. As it progresses, you certainly hope that when kids understand that they have a safe, listening parent in their life, that can go a very long way toward them handling the inevitable stress that they're going to encounter. Often those stresses are not real. So those stresses are perceived, catastrophic thinking that can come along with adolescence. And it's a matter of making sure we're just tuned in, that we're noticing what's going on in their lives, and just being willing to ask those type of questions. How do you feel? If we do that right, eventually, if they ever get to a point where they feel suicidal, and then we ask, do you feel like killing yourself? We've done a better job of increasing the probability that we're going to have an authentic response and a much better chance to off-ramp, to change the trajectory of whatever's going on with emotional exhaustion and despair and and a real unhealthy perspective about things that can lead to self-harm. So I know there are probably 2 or 3 other more specific questions.
How social media may play into this.
Yeah. I literally just wrote an article in regard to social media and kids. There are an awful lot of social media sites and guidelines that suggest that kids who are younger than 13 really shouldn't even be connected to it. I would agree. I'm sure that's a matter of opinion rather than well-researched fact. But I think there's some pretty good research that can back up, some of that line in the sand, as well. But the bottom line is, it depends. We know that there are some 14 and 15-year-old kids, who are just extraordinarily more mature than we might think of as the general norm. And then there are some who are clearly not. So engagement with your kids to know that if a kid can't respond to you in a simple communication or conversation about their day and about how they're feeling in their day, I don't think it's reasonable to suspect that they're going to navigate everything that's happening in social media. So a very simple litmus test is my son or daughter communicating with me about the experience of their life? Are they able to talk about feelings? And are they able to connect what are the events that happen in their lives to the way that they feel? It's something that we as adults should do, but my guess is all of us know adults who don't do that very well. So if kids aren't doing that very well, then why would we suspect they are going to be just masterful in how they digest social media experience? They won't be. I would argue that is somewhat of a delusion that keeps us comfortable. Unfortunately, we used to say 5-10 years ago, put a DVD in front of your kid and it's kind of a cheap babysitter. I think that's just migrated to social media for teenagers. Let them be connected that way, and I may not need to be so. I may not need to work as hard as I should as a parent, and I'm not trying to claim a moral high ground. Parenting is exhausting. Our lives are exhausting, and so we know that so often parents know the right things to do. It's not rocket science, and yet they don't, just because at the end of the day they're tired. I mean, the divorce rate is partly a reflection of that too. Marriage is hard work, but it's emotionally exhausting work, and sometimes we just don't do it. So managing yourself, it keeps coming around in a circle. Taking care of yourself, putting the phone down maybe a little bit more, drawing back just a smidge, doing all those things that we talk about in healthcare all the time: exercise, nutrition, diet. It all connects the mind and the body, puts us in a better position to be emotionally healthy people. And if you're not an emotionally healthy person, it's really hard to be an emotionally healthy parent, and therefore very difficult to really guide your kids in a way that they're more resilient. Does that make any sense at all?
It makes 100% sense.
It makes sense to me.
It makes sense to us too.
No, I followed all of that. Do you have anything else? I feel like that was incredibly informational, and I feel like we covered
a lot.
I feel like we could talk about this all day.
One more thing I just wanted to hit on, because we do have a few more watchers right now, was that, and I think you kind of hit on this about the, to talking to a young child or maybe a teenager as using the words to not maybe sugarcoat over something.
You did ask that. That's
yep,
right.
and to maybe say, I don't want to maybe use the word suicide or killing yourself, but is that okay to use those type of words to a young child?
Yes, but. Okay. Yes, but. Again, awareness of that child's emotional maturity and vocabulary, their emotional competency. What words do they get? What words do they not get? A few years ago, I don't know exactly when, but the Iowa Youth Survey, in its initial, it's a survey of schools, and there's thousands of schools that participate. They do it every few years. They hit 6th grade. I think it's 6, 9, and 11, I think. I could be a little bit off on that. But then they do this over and over again every 2 years, and they ask just a range of questions that have to do with health, substance use, mental health, and suicide. And it's fascinating information. It's a lot of good information. It's easily researched by simple Google search. And part of what they did a few years ago is that they took out the term suicide in those questions. And they changed it because they had 6th grade respondents. And so they changed it to just simply, do you feel like killing yourself? Have you ever thought about killing yourself? And so that wasn't just a casual decision to change that language. That was well researched and well thought through. And they knew that they wanted to increase the reliability and validity of that information by asking a question in language that the participants in that study would actually be able, that we believe they would be able to respond to in an authentic way, instead of a 6th grader maybe not even really clear about what suicide means. I've heard about that. I've seen some television shows about that. But does that mean when you really get hurt bad, or what does that mean? Yeah. So it's possible. So yes, depending on the emotional maturity, as you are probably one of the best experts on your own kids, you're using the nickel words instead of the 25-cent words is probably the way to go. And so asking things that, do you feel like dying? Do you feel like you might want to harm yourself or hurt yourself? Do you feel like killing yourself? The simple words are probably the smartest place to start. Clearly with teenagers, again, 13, 14 and above, you can use probably a host of different words that are going to be meaningful for them, and that they're going to be able to at least understand what you're talking about, what the conversation is. But that's a very good basic question, and you did ask it before, and I got lost.
You're more than fine. I threw 5 questions at you.
That's fine. That's fine.
Do you have anything else, Lindsay?
No.
Well, I think that you've answered all of my questions as well. Is there anything else that you want to hit on or cover?
I'm really glad that you asked about the difference between how to respond and how not to respond. I'm hopeful that anybody who might get a chance to see this and hear this conversation, that they would try to hang on to that. If there's one piece of information I'd love them to hang on to.
Well, to recap what you said then for the people that maybe just tuned in. stability is the way to go.
Yeah, which just means basically ask the question and try to understand them. Be stable with them. Listen and understand. Don't get wrapped up in your own anxiety about the fact that somebody has said they might want to kill themselves and you're the one that's sitting there with them. Don't get so lost in that you just want them to change.
Yep.
No, just don't feel that way.
Yep.
That's an unhelpful response. The more helpful response is to just understand people, pay attention, to understand. It can be so simple, but it's extremely helpful. It's extremely important. So I really appreciate a chance to reiterate and highlight.
Yes.
So thank you.
Yes, thank you. I think that's it for today. Jeff, thank you so much for sitting down with us.
Thank you very much. I appreciate it, you guys. Thank you.
Yeah.
Yay, thank you. And if anyone has any other questions, comment and we will touch base with Dr. Jeff and